On August 27th, I was the first physician on scene at the Annunciation school shooting. When I arrived, I joined our paramedics in assessing children who had been shot in the back, arms, and head. As we took in the immense pain and fear in the eyes of those children, we tried to comfort them as they were rushed to the hospital. Once the critically injured had been transported, our focus shifted to children who said they were uninjured, though their uniforms were soaked in blood. We had to confirm whether it was their own blood or the blood of their classmate that they had tried to shield. I have cared for many victims of gunshots and been on scene for many multiple mass shootings. But what was different that morning was that these were children. There were many children in church. At Annunciation, I saw the horror in the eyes of these children. I saw the fear of parents desperate to know if their child was alive. And I heard the screams of mothers and fathers when they were told their child had been murdered. Those memories do not fade. At Annunciation, an assault weapon multiplied the number of children shot, turned minor wounds into life-threatening ones, and amplified the trauma for families, first responders, and healthcare workers. Gun violence is nothing new to our society, certainly not to our Black and brown communities that we serve. They have lived with this painful reality for decades. For those who say gun violence is a complicated issue, it isn't. You can make it complicated by blaming mental illness, but the truth is mass shooters are rarely suffering from mental illness in the way that we think of it. They are often lonely, angry, and isolated. Blaming mental illness only stigmatizes those already struggling. You can make it complicated by arguing that our schools need enhanced safety entrances. This lacks evidence and makes our schools feel like prisons rather than a welcoming learning environment. This is a public health issue, and we know how to address public health issues. We follow the evidence, and the evidence to this public health issue is clear. Limit access to certain weapons.